Assalamualaikum warahmatullahi wabarakatuh. We are from Group 4, consists of Kedah binti Rosli, Nur Fatin Adlina binti Muhammad Hasdi, Nur Aina Najwa binti Ishaq, and me, Alicia Syazwani binti Amir. And we are here today to present about our proposal, which is entitled The Rise of Mental Health Issues Among Students in Uitm Kedah. Okay, we will start off with the background of study. Mental health can be defined as a problem that influences the way of a person in thinking, feeling, and action. It also comprises emotional, psychological, and well-being in social settings. Generally, this topic is widely knowledge because of the current technology. There are various of platforms that has been digitized, such as newspaper, magazines, and radios. As the time passes by, the information is easier to retrieve at the tip of our finger if we compare it to before. And we can say that the current technology, the topic is widely acknowledged by students also. But unfortunately, the mental health issues are still increasing day by day. According to buku laporan pencapaian 2018 Pusat Kerjaya dan Kaunseling, there are almost 70 students that seek help from the counselling department of Uitm Kedah about their mental health. Mental health is still considered as a taboo topic because the one who experience it tend to stray away from the public eye, disregarding the issues by diminishing the help from others and hiding and trying to mask their feelings by being alone. For example, there are news about a 22-year-old who pursued a diploma of office management and technology course in Uitm Kedah that passed away because of stress and caused a fracture of blood vessel, but didn't show any signs of mental health issues at all. Mental health issues is silent but deadly killer. And this study is made to find the reason for this unending cycle and seek the resolution for the topic.
As for the problem segment, mental health issues are not something new and regular, yet there is not much concern on this matter. It has to be acknowledged and treated in the right ways. This issue is critical since it does not just affect student studies and health but can be fatal. The main problem is factors that cause students to develop mental health issues. It may arise from background of studies or any external difficulties. So, several reasons for university students' poor mental health have been reported globally. For example, according to Rose et al. 2017, increased mental distress in youth, a lack of personalized support due to a large cohort. According to Pathmaker 2003, social media according to Jacobson and Forstey 2011, financial stress caused by increased tuition fees according to Ghani 2016, and some of the leading causes of Malaysian students' mental health problems were related to heavy workload, financial difficulties, and family issues, according to Ministry of Health 2016 and Yusuf et al. 2010. A recent restructuring in Malaysian higher education, which classified public universities as research field specific and comprehensive, according to Ministry of Higher Education 2012, may be negatively affecting students' mental health as students experience uncertainty during this transformation, and this may leading to high anxiety, according to May and Yin 2015. However, there are multiple ways to treat mental health issue or to make it less severe. It includes self-help plan, psychotherapy, medications, peer support, and also alteration in studies. This study focuses on discovering the issue to find solution that helps students overcome this.
Assalamualaikum and greetings to my lecturer in this subject of EWC661 Sir Azlan bin Abdul Rahman. My name is Siti Haja binti Rosli and my matrix number is 2020852878. Now, for this part, I want to tell you about our objectives of this report writing. The purpose of this study is to investigate the rise of mental health issues among students in Uitm Kedah. These studies suggest several research objectives to be attained as follows. The first one is to identify the coping mechanism that help overcome these issues and to identify factors leading to the rise of mental health issues among students.
The significance of study on this topic would give insights of the respondent, which is Uitm Kedah students, regarding the awareness of mental health, the symptoms related, their experience of said symptoms, and how they cope with the issue. The data collected can be used and assist for Uitm Kedah to identify the conditions of their students that suffer from mental health issues and improve their learning system to be more conducive. Furthermore, this study can aid parents, lecturers and organisations in supporting or becoming an advocate for students to overcome their mental illnesses issues. As the saying goes, prevention is better than cure.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurena Najwa binti Ishaq, and as for our assignment topic, which is the rise of mental health illness, I will present about limitation of study and methodology. The study findings must be viewed in light of many limitations. The whole dissertation is centered on the objective in order to ensure that the final product meets all the research objectives. Therefore, the research is limited to the study of interventional and prospective observational study, as our purpose is to investigate the rise of mental health issues among students in Uitm Kedah. The research comes across a major limitation, which is small sample studies, and the example in this research is a university student in Uitm Kedah.
Next is the previous studies. From the previous studies, I have done the research and overall I have found 9 articles under the topic of mental health among students in Uitm Kedah. But in this presentation, I will present you just only 4 of them. The first one is from Muhammad Zarul Naim and Kamaruddin Osman 2021. Identify there are some significant implications in this study. The findings directly impact the COVID-19 pandemics, especially in terms of financial support and the emotional aspect of students, such as it is affect how students learn, where they will feel through anxiety, complicates focusing and attention capacities. Next article is from Sadia Salim and Zahid Mahmud 2013, acknowledge that students are more vulnerable to mental health problems than the general population. This is due to not only the stress of academic pressures, but also several factors like growing up to adulthood, the demands impending practical life, developing and maintaining relationships, and other extraneous factors. However, Nur Zafifa Kamarunzaman et al. 2020 states that most of students choose to remain silent and it becomes the role of educators to identify the problem and get them the help needed. Results indicate that knowing mental health information will increase the inclination of helping behavior. However, many did not refer to the in-house experts such as university counselor. Besides the absence of a mental health framework in higher institutions, these lecturers agree on having a quick reference to guide their help towards the students. And Last but not least, article from Nalini Amarugam et al. 2021 survey that the COVID-19 outbreak has increased students' level of stress and anxiety. This is more prevalent in both male and female students who obtain a lower GPA score, whilst home environment in the presence of their family were seen to support students to feel safe and less anxious. It did not, however, contribute to coping and managing their academic performance effectively. That's all about the objectives and the previous studies on these issues. Thank you from me.
Next, I will explain about the methodology. This study will be conducted at Uitm Kedah. The research instrument that will be used to collect the data is an online questionnaire. The questionnaire contains 3 parts, which is will contribute to a combination of qualitative and quantitative studies. Part A of the questionnaire gives information about the background of the respondents, such as age, gender, institute category, level of education, and course of studies. While Part B of the questionnaire consists of the question to identify the issue of mental illness among students. It will review the data in the closed-end question. It supplies choices and the respondents will select one. And as example, the respondent need to reply either yes or no in the box given. This section is important to extend the respondent general knowledge regarding the factor leading to the rise of mental health issue among students. While Part C consists of the question to identify the coping mechanism that help overcome